Hello, everyone. This is Blaine recording live from Center for Multicultural Health. Today, we are gathered to talk about the different health issues facing African women living in Seattle, Washington. We have
Maureen Kimani from Kenya.
Aisha Kaba from Guinea and the Ivory Coast.
Yeshite from Ethiopia.
in the following 5 to 10 minutes, we will be talking about just the different questions and issues that African women face. The first question that we're going to have is, what are the major health issues facing African women in Seattle?
Well, many African women in Seattle are dying of preventable diseases because they're so involved in taking care of their family and they don't have that much time to take care of themselves. So that is one reason.
I think some of the issues facing African women here, especially first-generation immigrants, are lifestyle diseases, high blood pressure, diabetes. It could also be fertility, because some of them experience difficulty in conceiving. And I think all of these are preventable, just like you said.
Yeah, and others that come to mind that are really pretty serious right now are HIV and AIDS, and also cancer, breast cancer and cervical cancer. These are things that we're seeing are really affecting the Seattle women in Washington.
Mm-hmm. Right. Now, you all mentioned the different health issues that African women face, and those are all preventable. So what type of prevention or what type of checkup or screening do they need to do in order to avoid that?
I think going regularly to the doctor at least once a year to do an annual checkup would make sure that either any issues that they're detected early enough in order to be treated. So going and doing a biometrics test to find out what your cholesterol level is, your blood sugar level is, your blood pressure as well, or cancer, if there is any cancer found, so that they can be detected at an early stage, treated, and save the life of that woman.
Mm-hmm.
I agree, because most African women wait until they're actually sick to get tested. So going early is the only way to save themselves in the future.
Yeah, I think getting tested, especially for HIV and AIDS, that's really good. I know people say, "What I don't know, it doesn't kill me," but really, you're dying if you don't know. So get tested for HIV, and there's a lot of help out there for women, especially immigrant women, so you can get the treatment that you need. So you're extending your life and not really living in this state of not knowing. So getting tested is a big thing for prevention.
Right. Now, y'all mentioned that getting tested and going to check up at the doctor's office is one of the main ways to protect yourself from these preventable diseases. But not all women have insurance. So it might be because they can't afford it that they don't go to get screens or to go get tested. So do you think, how much of an effect does that have?
I think for some of the illnesses we mentioned here, another measure is education. Them knowing that these are things that can happen to them as a consequence of some of their actions or some of the ways, that they're living in this country. So they can take steps to even not have to go to the doctor right away if they don't have insurance. So if you know that you have diabetes in your family, you would know to lower your carbohydrate intake, for example. Or if you have high blood pressure in your family, like I do, then you would realize that stress is a big factor, and then your intake of sodium as well is a big factor, and learn to control those so that at the very least, if it's inevitable, you delay the process until you can get to the hospital. Also, I think there are quite a few programs here that would let women basically go to the hospital.
Right.
And so that's another way where we can educate resources, letting them know where the resources are to go and find help or get help.
Yeah, even though insurance is a big issue, I strongly believe that even going to, public health, the little health centers, the community health centers, that one will be a first step in order to get help there, because they do have connections, for you to get treatment. So you can't sit down and say, I don't have insurance, I'm not going to get any treatment. There's always that first step, and the first step is really important to just, being in a state of not knowing. I think the state of not knowing, that's the biggest step, because you're killing yourself slowly, you know, and being there and getting help, that's really important for women.
That's actually good to know, because I had no idea that you could go to some of the public health centers to get screened. I had no idea. So I think this is good information that needs to get out there. Like you said, you know, insurance is really expensive. If you wait for an emergency and have to take an ambulance ride, it costs anywhere from $900 to $1,100.
Exactly.
And just the thought of that can definitely hinder somebody from taking a step toward better health.
Yeah, I mean, another help that's out there is that some people that don't know about is Center for Multicultural Health offers free testing for HIV, and you don't even have to pay anything for it.
Yeah.
As a matter of fact, you get paid $20 just to go in there and test yourself, and that's a life-saving experience.
Yeah.
Yeah.
Actually, that reminded me, HIV testing, STDs here. So HPV is very common in this area. So I do not know what the number is among the African community, but we do know that women at this moment face more repercussion than males do. But it is contracted through sexual, contact. So be able to get screened for that as well, or even ask for it when it's not being offered to prevent cervical cancer, I think is going to be very important.
The next question is, although the HIV prevalence is declining and stabilizing, it still remains as one of the major issues facing our community. So how is it spreading in the African community, especially in women that are living around here in Seattle?
I believe, especially for women in Seattle, I think the public health had the statistics last year that, especially the East African community, the leading new infection cases that are showing up, Ethiopians, Kenyans, Somalians, and a lot of it is just basically what's happening is when people migrate, you go to Africa, you come back, especially if you're not faithful to your partner, so you come and you're unfaithful in Africa and you come back and you have the virus, so you spread it to your wife, to your girlfriend, to your husband, whatever. And that way we have new cases of HIV happening, especially in Seattle. Because we think about HIV, you think about Africa. You think it's an African issue for people in Africa, not for Africans who are now living in America. So, and then people don't get tested. You're not thinking about the risk and the repercussions, so you end up having this spread of HIV. And another thing is the community base. We have a pretty small community. It's not small, but people, so you end up going out with this person and going out with this person, and it's the same pool of people. So if you're infected with HIV, then you're going to end up infecting all those people who are going to infect other people in your community. So you see it spreads, and if you take action knowing your status, that helps you out. So you're not spreading it to the other person, and you're getting help and you're educating other people. So that's the biggest issue now for the African women in Seattle, the small community, not knowing and not getting tested, and how the virus being spread from Africa to America. So that's it.
Are some people contracting it here locally though,
Locally.
not within the African community?
It could be too. Yeah, it could be another thing. Because let's be honest that AIDS is still in America. There's still HIV being contracted in America. But the good thing with America, you can get the retrovirus, you can get the treatment, and you can look healthy and not skinny and dying as people in Africa look. So you have this healthy person who looks okay but has a virus. So that's another thing. It's also probably locally. People are getting infected locally. And that has to be addressed too, that you're not thinking, oh, I'm in America, I'm safe from this virus. But in reality, there's still people who have HIV. It's just a matter of getting help and getting healthy and eating healthy and looking okay, but still a problem. So, yeah.
How much do you think, I got something to say, I'm sorry.
Go ahead. No, I don't.
Okay. How much do you think that cultural, how much does culture play into HIV and going to get tested for it and having that, almost heart attack when you hear the news when you feel positive? How much does culture play a role in that?
Culture, I think, plays a huge factor. One thing is stigma. You know, you have
definitely.
you let your family know, oh, I have HIV and AIDS. You know, they will, just looking at you differently and not having that support system. So you can't just go, I'm going to get tested. And then if I find out I have HIV and AIDS, what am I going to tell my parents? What am I going to tell my community? Because, as an African woman being in Seattle, providing for your children, and also your parents back home and your family expecting you to like send them money and supporting them too. So you're in a position where you're sick, you can't support your family here and you can't support your family back home. So that you have so many things going in your head that you're scared to actually get tested because of the stigma. And also as a community, as a culture, the African culture, I think it's maybe a taboo for people to speak about, sexual protection, especially protecting yourself, and that needs to be opened up if people are gonna be safe. We have to get the conversation going and not be so culturally bound that we're forgetting that this is something that's killing our people. So.
Exactly.
I'm really curious, actually. Is that how it works in Kenya? Because, there's no sexual education whatsoever or sensibilization.
There is education. It's now getting better. Like people are being taught to use protection when you having sexual intercourse and stuff like that. But still, it's not as openly discussed as it needs to. There needs to be more. What I'm saying, there needs to be more conversation. There still is, but it's not to the extent that we're having this thing being talked about frequently. I think frequently is what I'm trying to say. Yeah, we need to have it frequently talked about. So
unfortunately, I'm not really aware of the problem within the West African community here as much, but I do know where I'm from. Growing up in the 90s, in high school, we used to do campaigns. There were major campaigns for fights against AIDS. And now it's openly talked about. When I went back to visit, when somebody has the virus, everybody knows that they have a virus. People hang out with them. So it's a lot more open. And I'm just wondering if things are different maybe elsewhere.
In Ethiopia, it's more like if someone finds out you have a virus, it's kind of, you're looked down upon. Like people don't understand, maybe it's because of the lack of education, people don't really understand how it's transmitted. So if someone has it, they don't even want to hang out with the person. And that's what I've noticed when I've gone back. So it's like there's a superstitions about how people can contract HIV. And I think like education is the number one thing that's needed over there, to actually educate people about how it actually is transmitted and it's not through touching someone.
So what you were saying, that was a big problem about 20 years ago.
It's still
where where I'm from. Where I'm from, it used to be a big problem where people find out because of the mystery of the disease, they abandon you. And I remember in high school where we would go and visit patients who are just there by themselves because nobody else, their family would not go and visit them. But it's gotten a lot better, better from my visit. Now, within the West African community here, I don't know.
All right, ladies. Well, we want to conclude our program with a short message from each and every one of you. So, Maureen.
Okay, I'll go first. I think the African woman is a beautiful woman who is strong and takes care of her family and should be here for a really long time. So my advice is to really get tested for some of these diseases that are preventable, and that you can elongate your life and continue taking care of your community and your family and yourself too.
Of course.
I believe that early diagnosis is the way to prevent diseases in African women, and that's the most important thing a woman can do for her family, because she will be able to live longer and support her family.
I think it's critical for us as African women to understand that there is a certain peace of mind that comes with knowing that you're healthy, and getting that confirmation from the doctor that you're healthy. And if you have children here, that you'll be here for a long time for them as well, to take care of them and take care of your family. So it is important to go on a yearly basis to do your annual checkup, even if there is nothing wrong with you. do not wait for pain or for a trigger before you go to the hospital. So make your physician or the community or the resources like the Multicultural Health Center your friends, your ally in becoming healthy or being healthy.
All right, thank you. And I hope everyone has taken something out of this conversation. And thank you for watching. Until next time, good day.